Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining me again today.
Of course, thanks for having me.
Absolutely. My name is Dilshad Burman. I'm a writer and reporter with City and 680 News, and I will be moderating this chat this week. The way it works is we've been collecting your questions over the past week, and we will present them to the doctor today. She's never seen them before. It's all off the cuff. If you haven't had a chance to submit your questions, you can still do so under this live broadcast, and we'll try to get to as many questions as we can within this short half-hour period that we have with the doctor. If we don't get to your questions, I do save them for next week, so please keep tuning in and we will get your questions answered. So doctor, are you ready to go for today?
Yeah, let's go.
Awesome. Let's get started. We have some vaccine questions to get through. We have been prioritizing vaccine questions over the past little while because that's top of mind right now and everybody's getting their shots. So we're going to start with a couple of travel questions regarding vaccines. Robert asks, I travel internationally for work. Will all other countries internationally recognize that I am fully vaccinated if I receive a mix of the two mRNA vaccines?
Well, certainly in Canada, we're recognizing that that is a complete series and are sharing that that is a complete series for Canada. Now, both of the Moderna and all of the Moderna, the Pfizer, and the AstraZeneca are listed on the World Health Organization as WHO approved vaccines. So that's the first point. And I know that our Canadian officials are looking at how to ensure that mixed schedules will be recognized for travel. So that's certainly something that's being looked at. And I'm hopeful for it. I mean, many hundreds of thousands of people in our country have mixed schedules based on the types of vaccines that were available and still provide very good protection.
Absolutely. And so you actually answered the second question already. Is Canada working with other countries to recognize that mixed vaccines is a fully vaccinated person? So wonderful. And then we'll move on to the next travel question here. Weem asks, we are traveling out of Canada. The destination requires that we have to have a vaccination certificate with a QR code on it. We are in Ontario. How can we get the vaccination record with that code on it?
So I'm not sure how you can get a vaccination record with a QR code, but I can certainly tell you that if you're vaccinated in Ontario, you can go into the provincial booking system. It doesn't matter where you got your vaccine, but if you go into the provincial booking system portal, put in your information, you can then get access to your record. And so for both doses, and you can share that.
Absolutely. Okay. And then, okay, Vanessa asks, if the vaccine is so safe and effective, then why are we still wearing masks after getting vaccinated? Before the vaccine rollout, all the government advertising for COVID said that you should wear a mask until you get vaccinated. And now that Canada has met the vaccination goals, why are the mask mandates still in effect?
Okay, well, yeah, it's a good question. A lot of the question revolves around this Delta variant that we have. And when the guidance first came out, it was based on the Alpha variant. Now, the Alpha variant spread more easily than even our original COVID, but this Delta variant spread even more than the Alpha variant. And because of that, we actually need even higher vaccination rates. We're actually seeing around the world in places like in the UK, in Israel. Now, they are ahead of us in vaccinations. We often use them as examples. And we're seeing where this Delta variant can then come and spread more easily, and especially among people who are unvaccinated. And so even a 70% vaccination rate, 75%, 80% vaccination rate, that still means 20%, 25% are unvaccinated.
Right.
And we know that this virus will then spread among those groups.
Okay, and then I guess this is kind of a related question. It's coming in live right now from Joe Jackson. They ask, when can we stop wearing the mask then? Everyone in the US isn't wearing it anymore while attending basketball games, things like that. This doesn't make sense.
Yeah, so I mean, Public Health Agency of Canada released some guidance last week, which did say that if you're fully vaccinated, and you are outdoors, you know, the outdoors areas, especially when you can keep a physical distance and even when you can't with other fully vaccinated individuals, masks can be taken off. I think, and even indoors, the guidance also said if you're indoors with other people who are fully vaccinated, you can take a mask off. I think we have to realize that the mask adds another layer of protection. And if we're worried that the Delta variant is spreading, if we're with people who are unvaccinated, then that mask gives that additional layer of protection. So it's not quite as simple as all masks on, all masks off. It is very much dependent upon the situation that you're in and the vaccination status among the people that you're spending time with.
Right, absolutely. And then another live question coming in here from Michael. So does the vaccine protect against variants or not? You said it does, and then you said it doesn't. Which is it?
Yes, it does protect against variants if you're vaccinated, but if you're not vaccinated, it doesn't protect you. You don't have protection. So I think that's the point here. We have actually had 4 variants that have been identified worldwide, and all 4 of them have vaccine protection against the vaccines that we have available. And so but it is different. So with the Alpha variant, we knew with 1 dose of the vaccine in Ontario, we were getting 70% protection. And so that second dose was getting us beyond 90%. But with this Delta variant, it's actually the 2 doses that we need. The first dose is maybe 30 to 50%, and then that second dose boosts us past 90%. So that's the difference with this variant. But the vaccines still work, but we do need that second dose for that best protection.
Right, okay. And we're gonna go through some more live questions here. Zina asks, I'm terrified to get the vaccine. I think it's unsafe and we will have issues in the future if we get it. How sure are you that it is safe?
So, I can understand when people have, questions about the vaccine, they're not quite ready yet. I think there's a couple of things to remember is it's difficult living with COVID. It's been a very, very challenging year and a half. I can say that for me personally. And while I don't know everything about the future of the vaccine, because we haven't had the vaccines for even a year, even more than a year, I do know, though, that without COVID, another year without COVID will be extremely challenging. And I can say, so far, the vaccines have been safe, very safe, actually. They have side effects, as do all medications, but the side effects are rare. And we've seen how the vaccines have been able to protect people and keep them from, that severe illness.
Absolutely. And lots of live questions coming in here. Let's go to Stacy. Stacy Joel asks, what are your thoughts on the recent CDC information with children and the second dose? I'm very worried as a parent. One region was asked to wait 8 to 16 weeks. Why are others not doing the same?
Okay, so I think what you're talking about is last week the CDC had a really important meeting talking about myocarditis and pericarditis among youth. And actually, as part of that meeting, they did a very sophisticated analysis looking at the benefits and risks of vaccinations. And they actually have 2,700 youth and young adults who died of COVID since COVID started, including hundreds just since April. And so, and that was just deaths. They also looked at hospitalizations, severe illnesses from COVID. They didn't even consider, though, long COVID, which we know is actually problematic. We also know that kids can get that multi-inflammatory system. And so based on their analysis, the benefits of vaccination outweigh the risks. The risks of vaccination, from what we know so far of the people that have had this myocarditis, pericarditis, is it is mild illness. So, it's not a severe illness of the heart. It's occurring very rarely. And the people who get it are recovering after a few days with treatments.
Right. And then, doctor, when it comes to the gap between the 2 doses for kids, what is the optimal range there?
Yeah, so I know there's some question, well, what if you delay the second dose? Is that going to prevent this from occurring? And we actually don't know that. We do know that getting a second dose around 8 to 12 weeks, say, is better for an immune response. But, it's again, with COVID, everything is about balancing the benefits and risks. And if you live in a COVID hotspot that has the Delta variant identified, well, you want to protect yourself the best from getting the Delta variant, which means getting 2 doses at a shorter interval. So I think the best thing that I can say to you is, yes, a vaccine is recommended for youth. Yes, I would recommend that you get that second dose because that second dose is going to give you the best protection against the Delta variant. And watch for symptoms. Watch for chest pain, trouble breathing, or palpitations. And if you get them, go to the emergency department. They can test you. I can tell you, as an emerg doc, I've had patients come in, tested them, and it's not this, and so you can certainly test it easily to see whether it is or it isn't. And then there's good treatment for it.
Right. And doctor, has the interval reduced now in terms of, because right now we were waiting 4 months, now people are able to book earlier. So when it comes to kids, is it a much shorter interval now?
So the interval is based on the product monograph. And so it's about 1 month is the shortest interval. And so, as of Saturday, youth who live in a hotspot can book at that 1 month interval. And, again, if you're in a hotspot and you're at higher risk for Delta, even though you're a youth and you may have a higher risk with this cardiac condition with the second dose, you don't want to get Delta either. So I would still recommend that you get the vaccine.
Right. Okay. Let's go to some more live questions here. Surya asks, when do people need to get a third dose of the vaccine? Is that a thing? Are we doing third doses?
Not yet. No, it's not a thing right now. It is something to keep in mind for the future if we need a booster dose or if there's a new variant. But right now, no, you don't need to make plans for the third dose right now.
Okay, wonderful. And then Rawa asks another live question here. If I get my second dose today, is that going to affect my PCR test tomorrow?
So the PCR test is not dependent upon vaccination. So the PCR test actually looks for DNA of the virus, of the coronavirus, for which the coronavirus is actually not in the vaccination. So you cannot test positive on a PCR if you have been vaccinated.
Okay. And then we'll go back to our submitted questions here as more live questions come in. Regina asks, how can we extend the Pfizer for all 12-year-olds, everyone born in 2009, so that all the kids that are born in that year can get at least the first shot before school starts in September? It makes little sense to be grouped with 5 to 11-year-olds just because of a couple of months.
Yeah, so right now the policy decision in Ontario is when you turn 12, you're eligible. That is something that has been raised, like should it be, especially as we hit September and 11-year-olds wouldn't have been vaccinated going back to school. So that is something that may be under consideration, but right now you have to be 12 to get the vaccine.
12 complete, right? Because I know that for other, especially when it came to seniors, it was like if you turn 70 within the year, then you're able to get the vaccine. But I guess for kids, they have to complete the 12 years.
Yeah, and right now that was based on the fact that Health Canada approved it for 12 and up, not turning 12. So that's why that decision was made. But again, with all things COVID, things can change in the future.
Right. And then part 2 of Regina's question is, when is the Science Table of Ontario expected to issue a recommendation regarding the interval for second doses for teens? Has that been discussed yet? So
the National Advisory Committee on Immunization has a recommendation for teens and has been looking at this issue. I think though, beyond looking, I think we can look though at what happened in the US with the CDC and the Advisory Committee on Immunization Practices in the CDC right now continues.
Sorry, doctor, I'll just stop you for 1 second. We've lost your audio.
Can you hear me now?
There we go. Yes, thank you.
Okay. Yeah, so just to say that in Israel and the US, we're
Sorry,
interval.
We dropped out audio again. My apologies. Not sure.
Okay. Is it better now?
Yes.
Okay.
Thank you.
Yeah.
That's what happens with live
streaming. Yeah, so if the interval is recommended to change, we'll hear about that shortly. But right now in other countries, they've continued to keep that interval. Remember that shortened interval was originally because of vaccine supply. For AstraZeneca, it's 8 months because 8 weeks because we know that is provides the best booster after the second dose. And again, even with youth, it's about balancing. Can you wait 8 to 10 weeks to get that second dose, or are you at higher risk because you're in a Delta hotspot? Maybe you're, out and about and need that extra protection.
Right. And then we have another question coming in here from Vala. Says, I'm just going to try and get this question properly. So the 12-year-olds, does it mess with their reproductive ability in later years if you get the vaccine?
There's no evidence for that. There actually has been a study that was just recently published that looked at sperm counts actually in people who were vaccinated in males and found no difference, no change. So if reproductive, when we think about what ifs about the vaccine, we have to actually remember COVID. I mean, COVID is here. It's still spreading and can still make youth sick. Actually, about of youth who were hospitalized with COVID were healthy. They had no other health conditions.
Right. Sorry, doctor, could you repeat that percentage point? We missed that in the audio.
About 75%.
Okay. And then Marlena asks, does the Delta variant pose a risk for those 12 and under more so than the regular COVID strain?
So I think what we're finding is that the Delta variant is actually finding people who are not vaccinated. And we know that, 11 years and under can't be vaccinated because they don't have a vaccine. So I think that's part of it, is that the Delta variant will, because it's so transmissible, will infect people who are not vaccinated. Now, is it more serious in pediatric populations? I don't think we know that definitively right now.
Okay. And then more live questions coming in here. Shannon Mifflin asks, what does the shot actually do? We are being told the shot does not stop you from spreading or contracting the virus. If this is true, then would that not make this shot a therapeutic rather than an actual vaccine?
So the vaccine actually helps you to not get COVID and also prevents you from spreading COVID. So it actually works in both of those ways. The vaccine's not 100% chance that you could still get COVID, but even in that situation, COVID, you're more likely to get a milder illness and you're less likely to spread the virus even still.
Right. Okay, we'll go back to our submitted questions here. BB asks, Canadian experts have said Moderna and Pfizer is safe to mix as a first and second shot, reassuring us that it's like two brands of bottled water, it's the same ingredient. So if this is true, why is Pfizer the only choice for 12 to 17-year-olds and not Moderna? It seems like it's contradictory messaging.
Yeah, that's a good question. And it's actually about, because Pfizer is the only one that did the clinical trials in 12 to 15-year-olds. And so before we say mix and match in 12 to 15-year-olds, we still want to be able to ensure that Health Canada approves the vaccine in that age group that they've done the studies. Now, Health Canada has approved Moderna in 18 and up. And so in 18 and up, we can say that those two vaccines are interchangeable. In 12 to 17-year-olds, we can't say that until Moderna becomes licensed in that age group.
Right, okay. And then another live question coming in. Sherry Ellis asks, I have MS. My doctor said not to get the shot. Should I get it anyway?
Okay, so I can't comment specifically on your personal health condition, but I can say the vaccine is safe and actually very much recommended if you have MS, because should you get COVID, you could get a very severe illness. And so having MS is certainly not a contraindication for being vaccinated. I can tell you that much anyways.
Okay, for sure. And then let's go back to these submitted questions here. Jean asks, my husband and I both received our first vaccine shot in late April. At the time, we didn't realize that we had already contracted COVID from our daughter a few days earlier. We had very strong reactions to the vaccine. How long should we wait until we get our second dose? And do we even need to get a second dose? So first shot was in late April. They already had COVID. Now they're wondering about the second shot.
Yeah, so it's still recommended that you get the second shot. there are very few countries that are recommending just the one dose if you've already had COVID. And the COVID that you had in late April was probably the alpha variant, the UK variant, probably not the Delta variant. And so the reason why we're recommending that you get the 2 shots is so that you get that best protection, so that you're also covered against that Delta variant. And so, you know, there's no time interval. You don't have to extend the interval for getting that second shot, but I still would recommend it, yes.
Right, so if they're eligible, they should just book it and get it.
Yeah.
Right, and then more live questions coming in here. Okay, let's go to Michael. Michael says, is there anything we can do to boost our immune system if we choose not to get the vaccine?
I'm sure there are things that you can do to boost your immune system, like exercising, sleeping well, like all of those things boost your immune system. Just because you have a strong immune system, though, doesn't mean that you will be immune from COVID. We've seen young, healthy people get COVID, and some of them get very sick. So you really can't predict who is going to get very sick from COVID. If you have a health condition, you're more likely to get very sick. But there have been some people who have otherwise been healthy and still got very sick from COVID. So, you know, everyone wants a strong immune system. And I think that doing the right things to keep you healthy are really important. But that doesn't always mean that you'll have good protection against COVID.
Right, and we discussed this last week, that you're not just born with immunity to COVID. Like there isn't a percentage of the population that's just naturally immune to it. If you're immune to it, you probably had it.
That's right, but even if you had it, suppose you had an asymptomatic infection you didn't know about, and you got immunity that way. We know that immunity tends not to last. It might last you for 3 months, maybe 6 months, but probably not longer than that, and might not provide you protection against the variants either.
Mm-hmm. Absolutely. And then more live questions coming in here. People are listening very carefully today. Rita Smith asks, how can you contract the virus while vaccinated, but then not spread it while vaccinated? It doesn't make sense to me.
Yes, good question. So actually what some studies are showing is that if you, so again, very small proportion of people who are vaccinated, to even 2-dose vaccinated and get COVID, get a mild illness. And what they found is that if they get COVID in that situation, they don't have a large viral load. Now that's a very medical term, but it means that, you know, in their nose where the virus is replicating, you actually don't have a lot of virus there. And so that means that you're less likely to spread it to others. So that's how that works.
Okay, yes, that's a good clarification. That was something I was wondering about too. So wonderful. And then, okay, let's take Tina's question. Tina Dixon asks, what are the worst side effects? I'm assuming of the virus, of the vaccine.
Of the vaccine, well, it depends on which vaccine. So I think, you know, with the AstraZeneca vaccine, we know that those rare blood clots are pretty serious side effects. With the Moderna and Pfizer vaccine, the most serious side effect, though rare, is that myocarditis, pericarditis. But even then, the symptoms are considered, or that condition is a milder case of it, resolves within a few days with treatments. And then the rest of it is really up to you in terms of preference. I know some people have had real swelling under their glands and didn't like that. Some people found the fever, high fever, or chills and shakes really troubling. But again, those side effects, you know, in my polling, it seems consistent with the data, usually last about 1 to 3 days.
Yes, absolutely. Actually, just on a personal note, for anybody that was worried about taking Pfizer and Moderna, I just got Pfizer as my first shot, Moderna as my second shot this past week. Very, very mild side effects. Something that I probably didn't even recognize because I have aches and pains anyway. So the little mild body ache that happened, the few chills that happened, I just thought the AC was too high. So it was very, very mild for me. I didn't have anybody to ask regarding a mixed dose schedule. I know it's not mixed because they're both mRNA vaccines, but different brands. And my experience personally was very, very mild. And so I understand the hesitancy and I understand people are scared, but if it helps to hear it, I got the mixed doses, I'm still here and everything was fine. So just wanted to put that out there for anybody that was scared or worried about.
Yeah, Thanks for sharing that, because I think we hear about one person who may have been in bed for a day after vaccination, and we think that that's going to happen to us, but actually those are few and far between. The majority of people have more of those milder symptoms that are bearable and still resolve within 3 days.
Yes, absolutely. My symptoms disappeared, I want to say, within 12 hours or so, like barely even overnight. I woke up fine. So it was very tolerable. And I think the main thing for a lot of people is the fear of being laid out for a couple of days. But personally, if you know that it's because of the vaccine, you know that it's going to go away. There's no fear that it's an unknown illness. And that, for me, helped a lot to know that it was going to go away.
Yeah.
Okay. So that's my personal experience. Anyway, let's get
back.
No,
thanks for sharing. That's really helpful to hear. Thank you.
Absolutely. Thank you. So okay, so we'll go back to the live questions that are coming in. Shannon Mifflin asks again. So the shot has the same timeline of natural immunity. So if you have had the virus, why would you need the shot at all?
If you had the virus, your immunity may not last. And we know that actually the vaccine gives you immunity that is longer lasting. We've seen that there's actually good immunity many, many months after the vaccination. And we can't say that you have immunity for 3 months because we haven't had the vaccine for 3 months, but the immunity is actually very strong and lasting. And so that's why we say the vaccination immunity is longer lasting compared to natural immunity.
Sorry, doctor, you said 3 months. We've had the vaccine for longer than 3 months now. So the immunity from COVID technically lasts for 3 months, correct?
Right, and the immunity from the vaccination can last for many, many months now, as much as we've tested so far, and continuing that line.
Right. Okay, understood. All right, so that's it for live questions for now. We're going to go back to our submitted questions. D asks, what can I do after being fully vaccinated? Will there be guidelines from your office?
Yeah, so the guidelines actually will be coming. Well, we've had the Public Health Agency of Canada guidelines for some national guidelines, and we know that Ontario is working on guidelines as well too. So yes, expect more to come from the province.
And then we've got a few minutes here. So, okay, Wings asks, this is interesting. Is it all right to ask for vaccinated staff when in the hospital for a procedure or ER services? COVID-19 vaccination is not mandatory for healthcare workers.
Okay, so I think different hospitals are coming up with different policies. It's certainly, you don't want to, as a healthcare worker, give COVID to your patients. I mean, that's certainly part of being a healthcare worker. You recognize that they're vulnerable. Now, in healthcare settings, they should be wearing, even whether they're vaccinated or not, their PPE. And so even if they were potentially contagious, wouldn't be able to spread it. You know, if you're wearing a proper mask and either face shield or goggles.
Right, but that's not an option to actually, I mean, I don't know I guess we have to all learn vaccine etiquette now. Like, what is the option? Can you actually ask a healthcare worker, are you vaccinated? And if you're not, I don't want to be treated by you.
Yes, I don't have guidance on that particular situation. Now, what I would recommend that you could do is you could send an email or a letter to the hospital administration and ask them what their policy is for staff vaccinations.
Right, yes, before you even go in, absolutely.
Yeah.
A couple of minutes here now, so we'll do these mask questions. Do masks still have to be worn in malls, even if most people say they have been vaccinated?
Yeah, so the indoor settings are places where I think will be the last for us to take our masks off. Right. You can't always know who's vaccinated. Plus, we also have 12% of our population, the children, who are not vaccinated. And so, and we know that the indoor setting is that higher risk setting. So we're going to need still higher vaccination rates. And we got to keep track of that Delta variant to make sure that it is coming down. We can see we're going to go into step 2 this week, yes. And we can expect that the COVID cases will increase as a result. But we want to make sure that they increase in a controlled way, because otherwise, and that's why we need to continue still a few more measures.
Right, absolutely. And we have 1 minute left. I'm going to squeeze in this last live question coming in from Rose. I had COVID and one shot of Pfizer. Do I really need the second shot? I was told I was safer than two shots.
Well, there's no question that one dose is better than no doses. Absolutely. So thank you for getting that first dose. I would still recommend that second dose, again, to give you protection against the Delta variant. Because I'm not sure that you have that protection with the one dose, and I'm not sure that the COVID that you had will give you that protection against that Delta variant.
Right, absolutely. And that brings us right to 1 o'clock. Thank you so much, Doctor, again, for all your patience in answering all of these questions. Thank you to everybody that submitted your live questions. I hope we got to most of them today. If not, we will have the doctor back with us next week. And so we will make sure we get them answered then. Thank you so much, everybody. Bye-bye.
Bye.